A growing number of doctors report that ketamine is proving effective in treating some patients with mental health conditions. In fact, a program in Nova Scotia has so far treated 20 patients who suffer from treatment-resistant depression. And for many of them, this drug has changed their lives. And while effective, the drug is considered off-label and is not covered by most provincial or private insurance plans. Joining us this morning with more is Dr. Abraham Nunes. He's a psychiatrist who runs the ketamine therapy program in Halifax. Great to have you with us this morning.
Good morning.
Can you explain to us, first of all, how ketamine therapy works in treating something like depression?
So the going hypothesis, or the leading hypothesis of how this improves depression, is that it induces a massive amount of new connections in the brain. So we call that an induction of neuroplasticity. And if you can actually preserve that plasticity, some experiments have shown that the effect of ketamine lasts longer. So this is one of the reasons why that hypothesis is so strong. But it remains somewhat of a mystery as to why forming lots of new connections in the brain makes you not feel depressed.
For the
so
20
that's still something to look at.
For the 20 people that you've treated so far, what's your metric? How do you gauge whether ketamine therapy is successful for them?
We measure their depression outcomes using validated rating scales very frequently, and then I follow them for some period of time afterwards. And so I see them before, and we look at essentially how much their symptoms have improved based on these metrics. And these are the metrics that are used in clinical trials. So these patients are followed very closely.
Actor Matthew Perry's death made headlines back in 2023 after it was determined that he died from an overdose of ketamine. And he did begin using the drug legally through his doctor before he began buying it illegally. What kinds of safeguards are in place to prevent misuse?
So we screen people very carefully at the outset to ensure that we're treating people who have essentially minimal risk for developing substance use disorders. And then we follow them as they go along to ensure that there's not any development of dependence or any substance-seeking types of behavior.
I understand your plan right now is to eventually launch a pilot project, after which you would request stable funding from the government. So we reached out to the province of Ontario. They said there are no plans currently to include ketamine infusion treatment as an insured procedure or ketamine as a benefit under the Nova Scotia Pharmacare program. I think I said the Ontario government, but I did mean Nova Scotia. What concerns does that response mean for you?
Well, before tablet computers came out, we weren't planning on buying them. You have to sometimes see what an intervention or a program can do for you before you really consider putting money into it. Now, people who come into hospital with severe depression are sometimes here for months on end. And I think that with ketamine therapy, I think we're going to see quite massive reductions in the length of stay in hospital. And as we treat more people, you'll see some of the remarkable stories like what have been in the media recently.
Yeah, and for people who are just, starting to learn about this, it's important to point out it's not a cure, but it does improve the symptoms and outcomes for people who live with depression.
Tremendously.
A prescription form of ketamine was approved in the United States back in 2019, which points to perhaps changing attitudes around the drug internationally. But as long as this kind of a treatment remains uncovered by provinces in Canada, where does that leave patients like the ones you treat?
So some patients can access ketamine privately if they have coverage or if they're willing to pay quite large fees out of pocket. The patients who I treat here at the hospital, they don't have coverage for private treatment. And so they'll rely essentially on compassionate programs or whatever might be available through their local hospitals if there's someone there providing these infusions. But it's a tough spot to be in for them right now.
Yeah, how much does it cost?
So at a private clinic, it can range anywhere from $550 to $750 per infusion.
And how often do they get them a year?
So an acute course of infusions is typically 6 infusions over about 2 weeks. Sometimes it can be over 3 weeks or so. So you're looking at least 6 times $750.
Dr. Abraham Nunes, I'm glad to have you on the show today. Thanks so much for joining us.
Thank you.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.